Good day, I'm Esguerra, and today we're going to report about the muscular system of our body. First, what is muscular system? It is an organ system consisting of three classifications, which is skeletal, smooth, and cardiac muscles. It is the reason behind the movement of our body, maintains posture, and the circulation of the blood throughout our body. Invertebrates is controlled to our nervous system, while some muscles can be completely autonomous or involuntary, like our cardiac muscle, which is our heart. These are the three types of muscle. One is the skeletal, which is controlled by our nervous system, while our smooth and cardiac muscles is involuntary or completely autonomous.
Hi, I'm Karla Calingo, and I'll be reporting about your cardiac muscles. Your cardiac muscle is basically in your heart. So I have a diagram that shows you the basic parts of your heart. So first you have your aorta, your pulmonary trunk, your superior and inferior vena cava, your left and right atrium, and then your right and left ventricle. So your cardiac muscle is also known as the myocardium. So these muscles are similar to smooth muscles in the sense that they're autonomous or that they're involuntary, meaning that it doesn't require conscious effort to be able to move these muscles. So these muscles in your cardiac system are also thickened because it's required of them because of the stress that they endure while 24 hours a day pumping blood throughout your body. So cardiac muscle cells also have a quadrangular shape, and they also contain striations. So what are striations? Striations are lines or stripes running through your cardiac muscles.
Hi guys, I'm Zandra Benig. I'll be discussing one of the major muscle classification in our body, which is the smooth muscle. So smooth muscle contains actin and myosin filaments. So as you can see in the diagram, in every smooth muscle cells, there is nucleus centrally located inside the cell. So smooth muscles are also known as involuntary muscles, meaning a person cannot physically will them to move. Instead, it is controlled by our nervous system. So one of the examples of smooth muscle is the digestive system. So our esophagus contracts to move food down to our stomach. So in terms of appearance, smooth muscles are thin, long-shaped muscle cells that is attached to our bones. Also, smooth muscle cells are found in the blood vessels to help the blood move around our body.
So hi guys, I am Khiara Dañosos, and the second muscular system which I be discussing is the skeletal muscle. So as we can see in the diagram, here are the parts of the skeletal muscle. So the bone, the perimysium, the blood vessel, the muscle fiber, the fascicle, the endomysium, epimysium, and the tendon. So comes in different shapes and sizes as evidenced by a weightlifter's large muscle. So other skeletal muscles in the body you may not be as aware of include those in the neck or face, and even your tongue includes skeletal muscle. So it often works in pairs which work with the triceps which straighten the arms. So major skeletal muscle in the body include the deltoids, which is your shoulder, the pectorals, which is your chest, abdominals, which is your stomach, quadriceps, which is the thighs, and the gluteal muscle, which is your buttocks.
Hi, I'm Maylyn Capangpangan. I'm going to report the muscle contraction. Muscle is composed of a large number of muscle fibers. The muscle fibers are arranged in groups. Each group is under the control of a single motor neuron, the axon of which sends a terminal to each fiber of the group. All the muscle fibers of a group contract when a nerve impulse travels down their motor neurons. A motor neuron and a group of muscle fibers, innervated by its axon, constitute a functional unit called the motor unit. The number of muscle fiber and motor unit is variable and depends on the fineness of the control. A motor unit has to exercise. When a muscle is stimulated, a short latent period follows, during which is taking up the stimulus. then contraction, where it became short and thick, and finally it relaxes and elongates. In case of a tripped muscle fiber, the contraction lasts for only fraction of a second, and each contraction occurs in response to a single nerve impulse. For mechanism of muscle contraction, this picture shows that during muscle contraction, the laterally projecting head of the thick myofilament comes in contact with the thin actin myofilament and rotate on them. This pulls the thin myofilament towards the middle of the sarcomere past the thick myofilament. Next is the biochemical changes during muscular contraction. During muscular contraction, a number of biochemical changes occurs which were studied by Albert Zen Georgi in 1942 and later by R.E. Daves in 1963. In a resting muscle fiber, sarcolemma is electropositive outside and electronegative inside. This potential difference across a membrane is called resting potential. A membrane with such a resting potential is said to be polarized. Muscular dystrophy and cerebral palsy are among the most frequent diagnosed skeletal muscle diseases among children. Characterized by wasting away of the muscle, muscular dystrophy can cause varying degree of mobility problems as well as heart or lungs issues. Physical therapy and the use of supportive devices such as braces or wheelchair are standard treatment options for those who are diagnosed with muscular dystrophy. Cerebral palsy affects muscle tone and may lead to deformities involving the muscle or joints. Prescription medication, physical therapy, or surgical intervention may be used to treat cerebral palsy. Fibromyalgia is more common among women, although the reason for this is not clearly understood. Muscle pain, fatigue, and depression are among the most frequent reported symptoms of this illness. Treatment for fibromyalgia can be a bit complex and typically involves a combination of prescription medication, lifestyle adjustment, and physical therapy. For amyotrophic lateral sclerosis, also refers to as ALS or Lou Gehrig disease, is one of the most debilitating skeletal muscle diseases. This is progress disease that occur when the motor neuron in the brain and spinal cord become damaged. Over time, this leads to a lack of communication between the brain and the muscle, causing the patient to lose the ability to control muscle movement. ALS is considered a terminal illness, although medication and technological advances may be able to prolong the lives of patients with these diseases. For myasthenia gravis is an incurable disease that develops as a result of the breakdown of communication between the muscle and nerve of the body, leading to a loss of muscle control. Mobility issues are common, and the ability to breathe or swallow may also become affected. While prescription and medication are often useful for treating symptoms of myasthenia gravis, surgery or other medication procedures are frequently needed as well. Cardiomyopathy is a cardiac muscle diseases which is inability of the heart muscle to function properly. Next, I'm going to discuss to you the different kind of muscular system diseases, under skeletal muscle diseases, muscular dystrophy, fibromyalgia, cerebral palsy, amyotrophic lateral sclerosis, myasthenia gravis, and under cardiac muscle diseases is cardiomyopathy. Now, I'm going to show you some video and also pictures that shows the different kind of muscular diseases. For muscular dystrophy, for fibromyalgia, for cerebral palsy,
Can you walk over here? Come here. Whoa! Slow down, slow down!
for myotrophic lateral sclerosis, for myasthenia gravis, for cardiomyopathy.